Okay. We're live, just so you know. Hello?
Yeah, I'm trying to be able to pull up stuff while I'm talking to you.
Hi,
And
got
yeah,
gotcha,
yeah.
gotcha.
So, okay, you can start.
We've started. We're here.
Okay.
We are here. All right. Oh my gosh. Welcome, friends and family, to another of our weekly Saturday morning If You Could See Me podcast conversations with our amazing family members all over the place. And
Mhm.
here I am for the first time from the East Coast, from the West Coast. And I am, it's been quite a week. I'm super excited to be here with everybody. I am so honored and excited, especially after sort of recent circumstances, to have the beautiful and amazing Jamie Reavis here with us today to talk about an issue that I didn't know about. And I know that there are definitely racial disparities in our health systems in general. Absolutely racial disparities within the system, within women's health. But I was not aware until you, Jamie, brought this to my attention that, uh, you know, Black women have so much higher rates, in particular, of fibroid tumors. And no one knows why, and it hasn't been adequately researched, as with so many things in our systems that affect people of color and Black people in particular at so much higher rates.
Mhm.
Um, Talk about why you wanted to discuss this in particular today.
Um, well, for me, because it's, part of my personal journey,
Mm-hmm.
just recently having to have what is called an abdominal myonectomy,
Mm-hmm.
to remove fibroid tumors that were massive,
Mm-hmm.
um, that were, causing some internal problems, and definitely was told I wouldn't be able to have children if they were not removed.
Mm-hmm.
um and just wondering, it was, for me, it wasn't necessarily a race thing in the beginning.
Mm-hmm.
It was, why aren't we talking about this as women in general?
Mm-hmm.
The more I shared my story, the more feedback I got from women in my circle that I've known for years, that they've actually gone through this same journey. And this was everybody, people that looked like me, people that looked like Erin, Hispanic, it didn't matter. Like, it just, I was overwhelmed by the amount of women that said, yeah, I had this same surgery, or I had a hysterectomy. Um, and because of the fibroids or other issues like cyst, or just other hormonal disorders.
Mm-hmm.
But these were women I've known for years, and I never even knew that they went through this. So it was a silent journey.
Right.
um and so for me, I was just like, why aren't we talking about this? Like, how come nobody, I just, for me, it felt like it was so common,
Right.
but maybe it was brushed under the rug because the tumors are benign. They're not life threatening, even though they really can alter your way of life and how you get around, how you move. Um, I've just been really curious, and I feel like I'm just a beginner at, um, researching this and just finding out information. Like the article I sent to you, Erin, I just found it like that day. Um, and there's been a couple other articles I read since then. Um, and for me, it's just about everybody. I've even talked to men about their disparities when it comes to women's health, because what they don't have access to, we're held responsible for. which is not
Tell
fair.
me more about that.
One of the things that I was talking to my significant other at the time about, we were talking about how different diseases show up in men versus women.
Mm-hmm.
One of the things we talked about was like HPV.
Mm-hmm.
Um, there is currently no test for men for
Mm-hmm.
HPV. There's vaccine, but as far as testing and preventative stuff, that's really put on us as women.
Mm-hmm.
They detect that through pap smears, but you know, men aren't held. They don't. There's nothing for them, and they don't know if they are carriers or could be infecting somebody else.
Mm-hmm.
When you're and I've had doctors who um were kind of dismissive about that, like, oh, it's common. It usually disappears on its own, but then you hear the word cancer behind it, and that's scary. You know, it's just, for me, I've had more discussions about just all these different topics in the last couple years, and it just makes me wonder why is it that way? Why are we as women held more responsible for things that I feel like we should all have access to?
Yeah.
So I don't know.
Isn't that always the case, or
Yeah.
in many instances the case, that, if
Mhm.
it doesn't directly affect me, then it's not my responsibility. If it's,
Right.
I think so often you hear, um, you know, medical professionals say, "Oh, that's just the way we do it," and
Hmm.
or this is how it's done, and it's not just medical professionals; it's sort of everybody, and it
Right.
comes across as like, oh, okay, I'm just supposed to say, oh, okay, well, if that's how
Right.
it's
I'm supposed to accept it, but I'm like, the way my mind is set up is like, no, that's not right. Like, there's got to be a better way,
that
you
may
know?
have always been the way that we've done it, but that doesn't necessarily mean that that was the right way. That was the way
Right.
it was designed back in a time when, lots of things were different, right?
Right.
And so
Hmm.
now they're not that way anymore, and we know more
Yeah.
about many things, and we also know about, just in this particular example, we know more about, gender equity, and
Mhm.
we do hold men accountable for themselves in, more so than, or at least we're beginning to hold men more accountable for
Yeah.
themselves from, as far as their responsibility toward
Well,
women.
we try to, but when the healthcare system doesn't allow for that, you see what I'm
Exactly.
saying? And it's not that they don't want to. It's not like, in the conversation I had, it's not like he didn't want to participate. There was just no access to the same things,
Right. Mm-hmm.
So, because he was curious about certain things too. So there are men who want to participate.
Yes.
You know what I'm saying? But and they strongly, strongly support, women's rights and our equity. But it's just different. And I think I really, really encourage more discussion between men and women about these things, because there are a lot of good men out there, and women that, are open to these conversations, that really understand what we've gone through. As women, at what we've gone through as women of color, you know what I'm saying? So it's just, I personally want to learn more, and I personally want to have more conversations, because it's just necessary.
So when you read that article that you sent me, which I will link in the show
Oh,
notes, I want to
I
reference it.
wish I had sent you another one to
Well,
share.
I mean, send me more. I'll
Okay.
definitely read more, and we can continue this conversation. It just says understanding racial disparities for women with uterine fibroids.
Mm-hmm.
It says Black women are hit hardest by fibroids, diagnosed roughly 3 times as frequently as white women,
Mhm.
and with more severe symptoms. So,
Mhm.
the author of this article, or the subject of this article, is Erica Marsh is her name. She's a doctor,
Mhm.
and she's also a Black woman. And
Mhm.
so, she just said that basically, like everyone she knew all the women she knew growing up,
Mhm.
uh, had this. It was just sort of like par for the course. Everybody had it.
Mhm.
And so I had no idea that the rates were so much higher. My mother had fibroids, and did ultimately end up having to have a hysterectomy at
So did
42 years
mine.
old
Yeah,
because
so did mine.
because of fibroids.
Mhm.
Um, but I did not have any other family members when I was growing up
Mhm.
who had this. So,
Yeah.
what was your experience, and what did reading this article sort of bring up for you?
So the only people in my family that I knew back in the day that had fibroids was my mom.
Okay.
She had a hysterectomy, I think a partial hysterectomy in 2005.
Mhm.
And that was the only person at the time related to me that I knew had that issue.
Mhm.
Then I found out later that my aunt on my father's side had fibroids, and she had, I think, a couple of surgeries. Um, and I'm sure there's been more people in my family, but nobody's really talked about it. There's been other issues um, outside of fibroids, like can't always, I think it's like polycystic ovarian syndrome and stuff like that. I have a cousin that's had a lot of issues like that and has had to have like blood transfusions.
Mm.
Um, but I still don't feel like there's enough conversation about it,
Mhm.
even within my family, because I'm sure like there's other things that we found out over the years that we've had in common, like mental health stuff
Right.
that was never talked about, or um, finding out that pretty much, oh my gosh, I can't even tell you how many of us have been victims of sexual assault in some way in my family, and finding about that years later, like me and all my cousins and my aunts, like all of us have been a victim at some point. So I'm sure that if we had deeper conversations about fibroids and, fertility, a lot of these things would come up.
Right.
But that was my personal experience. And then of course people outside of my family, like a couple of women that went to my church, I know they had fibroids really bad and had to have surgeries and hysterectomies, um, blood transfusions behind that, um, so there was a lot of people that I found out not related to me that had the same journey.
Mhm.
um, I was I was really, when I was in the beginning stages of understanding how serious my situation was, I had a counselor that, I was sharing with, and counselors aren't necessarily supposed to disclose, but she felt like it was necessary because I was really stressed out to share with me that she went through the same thing.
Mhm.
And so just having that counselor to support me through a similar journey, and, she had a successful surgery and was still able to have children, but chose not to,
Right.
just having that discussion with someone like that, and she was a woman of color. um it was just very encouraging. So even outside of my family, those who have shared with me, I've had some people come to me and say, hey, I might be taking that step to have surgery, asking me about my experience. That's been a great network as well. Um, and I feel like, me posting certain things and opening up that conversation has been a good thing. Um,
So,
but yeah.
how do you feel your experience as this sort of very active, vocal, mental health advocate sort of prepared you in general for opening up dialogue with people who, about things that people don't normally talk about?
How did my experience
How did it?
prepare me?
Yeah.
Um, I
Or
don't,
did
I
it?
think all of that experience prepared me for this, because I learned in that experience to ask questions and to advocate for myself and to not just take the status quo of what somebody says as, you know, you have to ask questions. You have to read for yourself. You have to research for yourself and um, really understand the facts. In mental health, there's so much stigma that I've seen disappearing over the years, but in the beginning when I got into it there was still so much stigma, especially in the African American community.
Right.
um, and you have to know the facts. You have to know that mental health is not necessarily a death sentence. It doesn't mean that you can't function. It doesn't mean that you, you, you can't be you. You know what I'm saying? And
Yep.
and so all of those things.
But
um
sometimes you like need a person to start the
yeah,
dialogue, right?
yeah,
You
you need
need
that person to
somebody
start the
to be
dialogue.
like,
Yeah.
hey y'all, this doesn't have to be a death sentence.
And I had a lot of great support in the beginning. Well, I don't want to say in the very beginning, because when I first was diagnosed with depression and anxiety, I still didn't really understand it.
Right.
I still really wasn't sure that I would be okay.
Mm-hmm.
um Even though I had some support. And it wasn't till probably about 5 years later,
Mm.
when I was going through crisis, where I had people say, hey, like, this is your diagnosis. I had a diagnosis of borderline as well. And they said, we know this is what it is, and it's going to be okay. Like that. It wasn't until 5 years later where somebody actually validated and affirmed, like, this is not the end of the world. It's going to be all right. So for me, that was a huge part of changing things for me. And understanding that, I had that happen in crisis. And then when I got out of crisis, I was in a rap group. And my rap facilitator was a lady named Karen Calais from Fredericksburg.
What
And
tell the audience what RAP is. So
wellness, okay, wellness recovery action planning, which is uh Mary, I can't remember her middle name, Copeland. Basically, it's a plan to help you plan for when you're well and when you're not well, in regards to your mental health. But they also have rap for addiction. They have rap for physical disabilities. They have rap for everything now. So in the beginning of recovery for me, that was really important. It helped me put in perspective what I'm like when I'm well, what my triggers are, um, my coping skills, um, who I can count on when I'm in a crisis, what things work for me, what things don't.
and
Um,
RAP is facilitated by peers,
yeah.
correct?
Mm-hmm,
Yes.
mm-hmm,
And
mm-hmm,
so there's
yeah.
so much value in that, by receiving that sort of support and education from
Yeah.
somebody who lived through it, from
Right.
somebody
Right.
who's been where you are in some
Right.
capacity. Right.
Right.
Okay.
And it's a plan that's ever changing, which was really helpful for me to understand, because as you go through life, you change. You don't stay the same,
Right.
and you grow. And so your supports change, your triggers change. Some things get easier, some things could get worse.
Right.
So
Right.
that's,
Or you
yeah.
could find yourself in a situation where you're having a serious health concern.
Right.
And whereas before that wasn't a factor in your
Right.
well-being, and now it is. And so how do you address your mental health issues in the function of learning to now manage a physical health condition?
Which is kind of what I've been dealing with lately,
Right.
with going through this surgery and then having a complication from the surgery.
Right.
That in itself, I'm doing fine today with my mental health, but there were a couple days where I just felt like, what in the world? Like, because you're not yourself. I'm a person that's physically active and very independent. So getting up, doing what I need to do, I don't wait for anybody else to do them for me. Like, that's just, my grandmother said to me years ago, She said, "You're one of my most independent grandchildren." And that I don't necessarily ask for permission, I just do.
Right.
Which is something that I learned in my mental health journey, you
Mhm.
know, to just do. And so for me to have to sit back and be still is one thing. But then having a complication, I had the surgery for the fibroids on the 14th, and then went to the emergency room on May the 24th because I had a really bad headache for like 3 days. It
Yeah.
was like a scale 10 out of 10. Went to the emergency room for the headache. And then when I got there, TMI alert, everybody. When I got there, I had fluid everywhere.
Yeah.
And basically, that's when I knew something was wrong. And of course, found out I had an infection and had to have a second surgery. And then that was another Monday through Friday stay in the hospital. So, um, that, and there's just so many more details about it. Like, I have a wound vac now, which, if you don't know what a wound vac is, all I can say is Google it. That's where I'm going to say Google. But just going through all of that and just trying to still be myself. And somebody had to say to me, you have to understand the physical trauma that you just went through.
That's right.
And it's really, I'm not going to feel like myself.
That's right.
Um, you know, I broke down so many times, met with the chaplain in the hospital. Um, just, it's been different. It's been different. And I said, I understand. I never went through anything this physical. Like, I had like, I was on crutches my senior year in high school.
Right.
Um, and having the fibroids were physical, but they caused me internal issues, but they didn't cause me pain. Like, they caused me, I had really heavy cycles.
Mhm.
So I had to have accommodations, during my time of the month because of that. But it didn't stop me from being active. You know what I'm saying? Like, it wasn't like this. Um, and
Yeah.
so,
I mean, you had
yeah,
two major surgeries in,
in like less than a week.
two, right.
Yeah.
So
Well, less than 2 weeks. Yeah. Mm-hmm.
that's not something that you just go, oh, I did this and now I've got to, now I can
Mm-hmm.
jump up and go do the laundry and run around and,
Right.
get everything
Right.
done.
And having to lean on others for support.
It's hard.
I'm so grateful for my father and my sister. But then, I know they get tired. So, that guilt tries to come on you and you're like, you know,
It's so hard.
yeah, it's really hard.
Hard after major surgery, having to rely on other people to do
Mm-hmm.
basic things for you.
Mm-hmm.
And I do think that there is, there's all that other stuff that we carry around with us, especially when you're a trauma survivor.
Mm-hmm.
You already carry around a lot of guilt and shame
Mm-hmm.
about everything.
Mm-hmm.
And, so being in situations where you are dependent on other people, like you just don't have a choice,
Mm-hmm.
where you are feeling like you're not in control.
Exactly.
That,
Exactly.
when you have survived a lot and you have always been really independent in
Mm-hmm.
many ways because of your need to survive,
Mm-hmm.
when you are in a position where you're not in control, that is such a huge trigger that,
Yeah.
that can cause you to just spiral if you're not
Yeah.
careful, if you're not aware of yourself.
Yeah. Me and my sister, we've had that conversation about control so much in our lives because that's something that we've had issues with.
Yeah.
And so relinquishing that control, it's just hard, period. It's just
Mhm.
hard. You can't drive. Like you said, you can't even uh shower like you want to, just things like things like that are part of your wellness, and it changes things. And the thing that helps me is that, yes, I know it's temporary, and I have to keep telling myself that it's temporary. But then I think about people who go through this every day and it's not temporary. You know what I'm saying? Like, this is a permanent way of life for them. And so it just makes me have compassion not that I didn't have compassion before, but it just
Different.
it's different
It's
on a whole
different
nother
when you've
level.
lived through something.
Right.
Hmm.
Right. So, um, just makes you not take things for granted.
Yeah.
I keep saying this, when I'm free of this thing, I'm out. Like, you know,
I'm just never
but
gonna stop running. I'm just gonna
right,
keep going forever.
right. Because, again, just taking for granted physical activity.
Yeah.
Um, I don't want to do that anymore
Hmm.
for me. So, I'm hopefully learning lessons that I need to learn from this and getting a lot out of it. And not just feeling sorry for myself, of course. And then also using this time of rest to do some things I need to do. There's a reason for everything, and I try to keep my mind focused on those things so that I can stay mentally well.
Right.
And then doing things like yesterday, going to sit out in the sunshine on the porch. So that I can do that. I can't go for a walk like I want to, but I can do that. So
But that
yeah.
is like, that's the difference between, you know, low baseline
Mhm.
and in the depths of despair,
Right.
right? Just
And
like continuing to show up in
yeah,
those small ways.
yeah. Yeah, and I mean, it's hard, but I know one of the things that I just don't want to give into that darkness that I've felt before.
Yeah.
And that's just me personally, not saying that anybody gives into anything, but
Right.
I know that I've learned how to cope, and I have to use those tools. If I don't use those tools, then that darkness is going to come back. And so, and then also being vocal, talking about it like we are today,
Hmm.
having these conversations. It's necessary.
Yeah.
It's necessary to stay well, and hopefully continue to have the conversations. There's so much um that I want to learn, that I want to share and be vocal about in regards to women's health and fibroids, and not just taking what I thank God for doctors and stuff like that, but you know, there's a textbook and then there's real life.
Right. Well, and that was actually what I was going to ask you is, I think it's so important for people to tell the stories of their lived experiences, right?
Mhm.
And so that's mental health, that's physical health, that's,
Mhm.
what was your experience in the hospital? Like, how do you feel like your care was? Where do you feel
Okay.
like there are gaps, or where where people uh, you know have a textbook in their head about how to treat A, B, and
So
C, but
yeah,
not a textbook in their head about how to treat a person.
I can really speak to that. So, I do work in healthcare.
Mhm.
So the gaps that I felt like I saw prior to my own personal experience in regards to women or surgeries and hospital stays, or, women even having children, the standard time frame for the surgery that I have is a 1 to 3 day stay in the hospital.
Mhm.
And then they send you home to heal.
Mhm.
Um, and that's for anybody. That's for anybody.
Mhm.
Um, I felt like that turnover was too fast.
Right.
One of the articles I read, I wish I knew the source, but I don't know it off the top of my head, said that an abdominal myomectomy is in the top three of the most difficult surgeries, period. Top three. So for a top three surgery, why is a standard hospital stay 1 to 3 days?
Mhm.
You're literally cutting into somebody's abdomen. And, it's the same incision as a C-section.
Mhm.
Uh, C-section standard for um, the insurance company I work for, I'm not going to say their name, is 3 to 5 days for a C-section.
Yeah. I've had
So
3 C-sections, and each one I was in the hospital for 4 days.
yeah, and I just kind of feel like everybody is not the same. The medical necessity criteria needs to be a little bit broader for the hospital stays. And so I feel like I don't know if the complication would have happened if I would have stayed longer in the hospital or not,
Right.
but I just kind of feel like there needed to be more attention to this issue, not just for me, but for everybody, because it's such a major surgery.
Right.
Why are we kicking people out? Somebody shared with me and said that for a less invasive procedure, they were in the hospital for, I think, 2 weeks. 2 weeks for
Wow.
something that was less
2
invasive.
weeks.
Yeah. And they didn't understand why women were being kicked out the hospital in a couple of days from something like this. And this was a man that shared this with me. It was like a surgery that he had on his arm after he got caught in a conveyor belt.
Oh.
Yeah, I mean, so it was a major surgery, but still, he was like, and they put me on antibiotics as preventative. He was surprised that they didn't put me on antibiotics as preventative. And I said, no, most places wait till you're going through something to give you antibiotics. But he just didn't understand why that wasn't done. He didn't understand that. And, I was telling him, based on my research, that's just standard protocol and that's textbook. And so unfortunately, I feel like doctors need to pay more attention to not just the textbook, but what is the best practice, right? If infection, and I think the rate of infection is like 5% or less. So I can
So the
understand.
infection that you had was pretty rare and probably was surprising to them.
Well, it wasn't surprising because it's always a possibility, but the percentage of that possibility is like 5% or less.
Right.
And so at least that's what I was told. I haven't researched that for myself yet.
Right.
I'll let you know if I find out something different.
Yeah.
And so it's always something that they warn you about prior to. They
Right.
warn you about the possibilities, but again, they make you feel like it's so rare that it's probably not going to happen.
Right.
And then of course,
but it's also possible that, if they didn't send you home so quickly, that they can catch the development of an infection sooner and put you on those antibiotics so that you're not in a position where you then have to be hospitalized for a week afterwards.
It's a possibility.
And have to have a vacuum and another surgery and ultimately not making that decision ends up costing a lot more money to everyone if you're looking at cost benefit analysis of situations, which
because giving a preventative antibiotic is so much cheaper than another surgery,
right? Exactly.
even if you send me home in the same amount of time, just knowing the rate of infection is a possibility, even saying just take this for a couple of days, you just never know how much that's going to make a difference. And when you haven't been through it before, you don't really know what to look for, right? So like I had swelling, but swelling is normal.
You didn't know what that was supposed to be. You're not a doctor.
Right. So, I don't know certain things. Like I had one day where I did start throwing up and I did notify my doctor and they were like, okay, if it continues for 24 hours, then let us know, which of course it stopped. But I don't know if infection had started that day or not, and there's a lot of things that I understand that they have to play by ear, but we rely on them, so you just don't know, I know for me, I just didn't know until I pulled up and there was a situation. So I'm like, okay.
So Jamie, in a lot of things that that I have read and stories that I have heard from African American women and people of color in general is that in many cases, um, their their concerns are dismissed, or complaints of pain, or the research that I have read has stated that Black women in general are sort of considered to have higher levels of pain tolerance, and not their complaints are not as closely or seriously regarded by doctors. And I mean, I realize that it would be difficult for you as a Black woman to speak for all Black women, and also it would be difficult for you to know what your treatment would be if you were a white woman, or some other racial background. But I am curious if you felt heard, seen, listened to, and if you felt like your concerns were being taken into account.
So picking back on what you said, yeah, unfortunately, the whole myth about pain tolerance goes back to slavery,
Right.
when we were experimented on and basically treated like animals and said that we couldn't feel any pain. I remember the first time I learned that information, and I don't know, that did something to my soul, because we all know that even animals do feel pain.
Yes.
So why, I just can't even begin to go there. But in my experience, if I didn't know how to advocate for myself, I think that it would be different.
Right.
And what I've learned is a lot of people don't know how to have that voice. Going through mental health experience prepared me for the physical experience on how to advocate. There were a lot of things I didn't know to ask for or say with the physical experience with my first day in the hospital.
Right.
The second time around, I knew what to say.
Yeah.
And I knew how to basically demand it. I'm going to try to give you a couple of examples. One, I went to the ER, and I'm grateful for the hospital that I'm at. I'm really trying not to put anybody under the rug, but
right.
Grateful for the hospital.
I definitely, I appreciate that, because we all realize that, especially those of us who work within certain systems, that, these systems are flawed, but they are made up of a whole lot of actual individual people who are working really hard to do the best job they can within really flawed systems.
Right.
And so, like, it's a really important, I think, to always say that, like, we want to make sure that things get better. That's why we talk about this. It's not about, coming on and saying you did bad and you suck and we hate you.
In that same health system, I had a lot of great experiences during my hospital stay.
Right. Exactly.
But the parts where I had to advocate for myself, one example was going to the emergency room, and the girl that was left to draw my blood didn't have a clue what she was doing. And I think that she was a student. I wasn't sure. But she was fiddling around my arm, and I literally had to say to her, if you are not confident, do not stick me. I don't want you digging in my arm. Right. And she just kind of hesitated. And I said, you need to find somebody that's more confident, because I've been through enough. I don't want to go through this.
You're not a pincushion.
Right. And so she stopped and went to look for somebody. If I didn't know to say that, I would have been a pincushion, basically.
Right.
And I had a couple times where, like, the first surgery that I had on May the 14th, they put you under, and they have to use a breathing tube. And it was very hard recovering from that. Like, I felt like I had a sore throat, and I felt like I had something in the back of my throat for like several days. So when they told me I was going to have to be put under again, I immediately was like, oh my gosh, I don't want to have to go through that again. That was awful. So I had the thought, talk to your doctor about that. Talk to my doctor. She was like, there may be something that the anesthesiologist can do. talked to the anesthesiologist, and they heard me. I felt very heard, and they were like, yeah, we can try to see, because it's not as invasive as the first time. And what they did for me was they used a smaller breathing tube.
Mm-hmm.
So when I came through, I had some soreness, but I didn't have that crazy feeling in the back of my throat, and I recovered very quickly.
Mm-hmm.
So I felt heard, but that's because I knew
How to
how
advocate.
to advocate.
Mm-hmm.
And so many people just don't know that. They
Yes.
don't know that they can ask for an alternative.
Yeah.
Um, and I really didn't know I could ask for an alternative. It was just, I really feel like the help of the Holy Spirit. That's just me. And just that gut instinct of, I don't want to go through that again.
Right.
I've already been through enough. There's got to be a better way. And without asking those questions, I would not have known there was another way.
Right.
Um,
And you had, years up to this point of
mhm.
experience as a person who advocates, as a
Yeah.
person who knows that, like not in every situation can you ask for what you want and get what you want.
And get what
But
you want. And the thing is, they could have said no, there's no other way, but at least you still ask the question.
exactly.
Um,
Exactly.
and there's just been a lot of moments that I've had like that over the years. My mom used to always say to me, "You have not because you ask not." And so having that growing up, I remember a time where I didn't really I had to find my voice.
Yeah.
Um, and having to speak up for others, I did get a lot of practice in doing that, because a lot of people just don't know. One of the things with peer support, you may have to, when you're working as a peer support specialist, you may be with a peer at a doctor's appointment, helping them advocate for different medication that doesn't have as many side effects, or a different counselor because they're not doing well with the counselor that they have. There's just many times where you end up helping someone who is afraid to really ask for what they need. And sometimes I still have a hard time asking for what I need, but when you're in a crunch and you're already been operated on, we need another way, doctor. Is there another way? And then even another experience was they put an IV in my hand the first hospital stay, and they bruised my vein, and I felt it like all the way down my wrist.
Mm.
And so this time I was like, I was in the recovery room after the second surgery, and they were trying to draw blood. I have no idea why they were trying to draw blood after the surgery, but I just had blood drawn before the surgery, had the surgery, and they couldn't find a vein because my veins pretty much had collapsed. And I had gone without food for like 36 hours. That was let me talk about that for a minute. That was an area where I felt unheard. I came to the ER. We got there like 4 or 5 o'clock in the morning. And of course, 4 or 5 o'clock in the morning, I had dinner the night before, like 7 or 8 something. So they didn't want me to eat because they didn't know what was going on.
Right.
Didn't want me to drink anything. Gave me IV, gave me medications. I think by 12 that afternoon, 11 or 12 something that afternoon, they had confirmed it was an infection, and they had confirmed that they had to do a second surgery,
Mm-hmm.
And that I would have to go under anesthesia. So, of course, going on under anesthesia, you can't eat.
Right.
But the surgery was supposed to be urgent, and it was supposed to be done within 8 hours of that request, around 12 noon. So by 8 o'clock that night, I was supposed to have surgery.
Mm-hmm.
I didn't have the surgery till 2:30 the next morning. So I went that entire time without food, and the only water I had was when I took oral medications. I was so angry because I could have ate something at 12 noon and still been fine for the surgery at 2 something in the morning.
Right.
I think that needed to be handled better for anybody. And I don't know. I think it was just poor judgment on everybody's part. Because even though my surgery was urgent, there's always a possibility of emergency surgeries that come before mine, which is what kept happening.
Right.
So for me, I just felt like schedule the surgery for the next day and let me eat. That's why let me eat,
You're already really uncomfortable and in pain and, all of those things. Why also then make you go such a long time without eating? And obviously that sort of scheduling process is imperfect, but
right.
for goodness sake, making someone who's already in that situation have to go that long without eating.
Yeah. Yeah. So needless to say, by the time they were after the surgery, they were trying to draw blood, and my veins had no nutrients outside of the fluid they put in the IV, So the girl was trying to stick my hand again because she couldn't find a vein. I said, you will not stick my hand. I said, a patient has a right to refuse. I said, I waited to eat. You all will wait to stick me when my veins come back. I am not going through that again. And the girl was like, well, I said, ma'am, no. And I'm like in the recovery room, just coming out of surgery, finding my voice, like literally just waking up. But I was like, no. So she sent another guy over there, and I don't know if she thought it was going to be different because it was a guy,
Right.
But I told him the same thing. I said, y'all better find another place. But I don't understand why that hand IV is so painful. But I just was like, I'm not going to keep going through all this anguish because of this situation. And of course they found another place.
Yeah.
Right. So, just moments like that I had the second time around that I'm sure, like I said, the first time around, I would not have even known to speak to. And, somebody was like, well, why wouldn't they have tried to find another place in the hospital? I said, probably because it's textbook.
Right.
Why wouldn't they? Why? I said, because it's textbook,
This is how they do it.
It's how they do it. So, outside of that, I had a lot of good moments with nurses that definitely hurt me and my needs when I was during my stay. And I did feel very cared for.
Nurses are amazing.
They are. I did have one bad nurse when I was in the ER.
Yeah.
And it was really funny because my father was there, and it takes a lot for my dad to get upset.
Yeah. He was like not having it.
Not having it at all. But out of all the nurses I dealt with during those days, that one bad nurse, I wasn't going to let that ruin that for me because everybody else was wonderful, and just totally different.
Amazing.
So, and I had, some of the nurses I had the first time, I had the second time. So, we
like, welcome back.
Right. So we had that connection, and just overall, I will say the A West wing of the hospital, there are some great nurses up there. So, and so some people were like, are you ready to go home? I was like, I'm comfortable. They made me feel comfortable. I was like, I'm okay.
I'm good.
I didn't want to go home the second time until I knew it was time for me to go home.
Yeah.
Because I would, of what happened. So,
well, because that's one of those things. And, I think a lot of times, again, we don't connect. We do such a bad job just collectively, as a world, connecting the physical and the emotional or mental health aspects of things. And so, we don't recognize the trauma of hospitalization. We don't recognize the physical trauma of going through surgery and what that can do to you emotionally. And then yours was compounded by the fact that you had surgery for something that was already traumatizing. And then you have a physical surgery, which is traumatizing. And then you go home, with faith in all things that, it will work the way it's supposed to work, and you'll heal and you'll get back to your life. And then all of a sudden you have a life-threatening infection that ends you up back in the hospital with another surgery for another week.
Yeah. And I didn't realize how life-threatening it was even until after I got home, because somebody said, you could have ended up with sepsis. I didn't have, some people, when they have infection, they have fever. I didn't have a fever. I just had a headache. I did have some sweating, But because I deal with hormones all the time, it could have
Right.
been hormonal,
Right.
I just,
You,
but I didn't have a fever, which is really weird. Everybody was like, "Were you feverish?" I was like, "No." Even when I was throwing up, I took my temperature, no fever.
but that's another thing is that, over and over again, what you've expressed here is that, you know, textbook says this
Hmm.
happens.
Hmm.
Textbook says we do this, training says the expectation is the statistics are and at every turn,
Hmm.
you were an anomaly.
And everybody is different. And that's one thing I've learned about in the mental health movement and even in physical health. I can think of my father, this was years ago, I can't remember what year. My father had a really, really bad headache,
Mhm.
um, to the point where he had to go to the emergency room.
Mm.
And they ran all types of tests and couldn't figure out why. And my instinct was, you all need to check for meningitis. You all need to do a spinal tap. Because my father didn't have all of the symptoms, the doctor was very hesitant to do the spinal tap. And I was like, well, I don't remember what I said, but I spoke up on it. And of and so eventually they did do the spinal tap and found out that my father did have meningitis. Doctor came back in the room and was like, well, she was right. She hit the nail on the head. And so that right there is a prime example of you have to do your due diligence. As a healthcare provider, we rely on you all to do your due diligence in
Yeah.
every situation. If you cannot find the answers, keep looking for the answer,
Mhm.
because obviously this person is having a problem and there's a reason.
Mhm.
And we come to you all for that help, for that knowledge that we don't have because we didn't go to school. I shouldn't, I didn't go to medical school, so I shouldn't have to tell you to test for spinal meningitis.
Right.
I shouldn't, you know. So I think those are the things that sometimes healthcare providers take for granted. And I hope that this podcast encourages people to use their voice, or if you don't know how to use your voice, then reach out to somebody that can help you,
Right.
to read, to educate yourself. If you know you're going to have a procedure, research everything around it. And you still won't always have the answers. Like I said, I researched the surgery, but I still didn't know what abnormal swelling looked like, which come to find out I did have abnormal swelling, which was caused by the infection.
Mhm.
You know, there was just certain things that I wouldn't know because I didn't go to med school. So, you know, I just hope that we continue to have these conversations because it's so important.
Well, that's the thing is that there's so many factors, I think, that are made better, that are improved in this situation
Mhm.
when we just talk about it.
Mhm.
Right? When we give one another permission to talk about the weird stuff that happens with our minds and our bodies, the
Mhm.
in many cases, perfectly normal human stuff that many people have, we don't talk about it. Right?
Mhm.
We don't
Mhm.
talk about those things because it's not polite, or it makes people uncomfortable, or no, people don't know what to say. And, so again, and this, we always come back to this on this show and in this project about, the value of like, it's not my job to stay quiet so you can stay comfortable. I'm
Mhm.
not going to be silent because ultimately bad things happen when we are
When we're
silent,
silent. Yeah, and
right?
I just think about the things that even through life, if I didn't know how to advocate, I had a former supervisor. I was laid off from a job, and I just simply asked for them. They offered me a severance, and I asked them to continue my health care for 2 months after I was laid off. My supervisor said, well, I don't know if they'll do that, but I'll ask. And of course, they allowed that to happen. She said, you taught me something about advocacy and
Yep.
advocating for yourself. And she said, she had never been that person.
Mhm.
Um, and again, that goes back to you have not because you ask not.
It's so amazing. It's so important.
Mm-hmm.
You know, that's the other piece of this is
Mm-hmm.
like talk about it to each other, but then also normalize
Normalize.
advocating for yourself.
Yeah, and we have to, especially in the African American community, because there are unconscious biases and some, unfortunately, even in this time, providers don't necessarily know that they don't recognize the different treatment.
Yes.
Um, they don't, they just don't see it. So you have to speak up. And you don't have to be anybody but yourself when you're speaking up, when you're asking questions. I really feel like I've had favor, a lot of favor, um, where I haven't been given a lot of no's
Right.
when I ask. Um, I know that people that look like me get a lot of no's. Um, but I've had some favor just simply having those conversations. Um, and I think even some of those asks probably made different people think like, oh, I didn't think about it like that. But yeah, we have a different option for you, especially with the anesthesiologist, you know. Um, and I had a couple of the nurses and doctors say to me that I was one of the more pleasant people that they had to take care of, which is a blessing to hear because they could have been like, well, she's crazy. She keep asking all this stuff. But, I just kind of feel like I want to encourage everybody, but especially people that look like me, for us to find our voice, because there are some good people in the systems of care that are willing to say yes,
Yep.
if we ask. And that's just my personal experience that I've had.
Yeah.
So I'm grateful for that because it could be very different, very, very different.
100%. And
Yeah.
what I know to be true is that we do teach others through our own self advocacy,
Hmm.
right?
Hmm.
It's always the case. People will. What just happened? Jamie just left. Um, I don't know what happened. She she went away. There we go.
I'm back.
What
I
happened?
think I accidentally hit the leave button in the corner of my screen because I just
Oh,
accidentally almost hit it again. So I think it was my fault.
okay. No worries.
Yeah.
Are you
Okay.
there? Okay,
Yeah, I'm
good.
here. All right. So no more. I moved my hand.
We're almost done anyway. But yeah, so I think, we always teach people through our own self advocacy, right?
Mhm.
And it's so important to do it. And it's also, I think there's value in honoring how difficult it can be.
It's very difficult
Yeah.
because you're afraid of rejection.
Mm-hmm.
You're afraid of disappointment. You're afraid of not being heard. If you've experienced a lot of not being heard in your life
Yeah.
and not a lot of validation, you lose that voice. And like I said, I've been through that. I had to figure out my voice,
Right.
when it was really hard. Um, I remember going through that experience in crisis and just finally starting to get my voice back. And for me, I felt like I was really new to advocating for myself. I can
Right.
advocate for everybody else. I'm
Yes.
very protective of everybody else, but trying to vocalize when I was feeling uncomfortable or feeling, um, just feeling disrespected, by staff in the care facilities that just basically I had to tell somebody in the crisis unit, it was just this mean girl. She was mean to everybody. And I literally had to find my voice and say, uh we're not animals. We're not here because we want to be. like, we're not here because we broke any laws, and even if we did, we still are human.
We don't
Like,
have this isn't a
and
character, right?
I said, you need to learn how to talk to people. I told her that. And what happened from that experience before I left out of there, she said, you need to be a peer support specialist.
Yeah.
The same person who was terrible said that. She said, you need to be a peer support specialist, because I guess whatever I said made her think about things that she hadn't thought about.
Yeah.
And that was really the beginning of me finding my voice in recovery. And just, I was so angry with this person. I wanted to go off on her, but that wasn't the answer. I really wanted to be honest. I wanted to punch her in the face, because she was treating, it was an older lady in there, and I'm real partial to senior citizens. I'm sorry.
Mm-hmm.
But she was treating this woman so poorly, and I was so fed up, because she said to me, my problem isn't with you, it's with her. And I that's when I let her know, you need to learn how to talk to people.
Right.
I don't care. And so that was definitely a life-changing moment for me, and I think for her as well.
Right.
And then I had somebody when I was at a Mental Health America event after that tell me I was the mother of advocacy, and I'm like, I'm new to this thing. I am not the mother of advocacy. I am very,
No,
very,
you
very
are really, really good at it, and to many people, you are.
Mm-hmm.
If you are the first person they see doing it,
mm-hmm.
and it's got an effect,
Mm-hmm.
then you're their example. You are.
Yeah, that's true.
You are.
Yeah.
It's not the mother of all advocacy. It's the
Yeah.
mother of advocacy to the people that you are affecting every day. And you're so good at this. I mean, we met quite a few years ago now, and you just have always been this kind of light with this sense of like purpose and confidence and deep commitment to knowing what's right.
Yeah.
And how people deserve to be treated. And that, people need to see that. And so I am so grateful to you for so soon after all of this happening, your willingness to come here and to talk about it and to share your personal experience, all the levels of it. People learn from seeing other people advocate for themselves. And what that does is that it puts those of us who are willing to advocate for ourselves in, a difficult position that can sometimes feel like a lot, right? Like, in addition to going through this awful medical situation, now I also have to share it all with the world. And so I recognize that your heart is in this work, and that you're so magnificent at it, and that it feeds you and it drives you in the world. And I want to recognize that it's not easy, no matter how amazing an advocate you are. It's not easy to come through something as traumatizing as you have come through the last couple of weeks, and then come on, be like, here's my experience. Hooray.
It's literally a day at a time, because, I mean, like I said, like I shared on my story, just not feeling like myself. I have days where I want to be bothered, days where I don't want to be bothered. I really prayed that I would feel good today, and I did, because I was like, I don't want to reschedule this. I don't, I just, oh, hello. Hello, what happened? I'm not sure what happened, or if everybody can still see me.
Are you there?
Yeah, I'm here.
I don't know what happened.
It's okay. I just can't see you, but I can hear you.
Hang on 1 second.
Okay.
Oh my gosh.
Uh-oh.
Can you hear me now?
I can hear you. I just can't
Oh,
see you.
I don't know why. There we
Okay.
go.
Yeah.
I don't know. Oh my gosh. I
Yeah.
think we're still, I'm pretty sure we're still streaming and everything's
Yeah, we
fine,
are.
but I don't know what just happened. Oh my
Yeah.
gosh. Okay, we'll edit this out when we put it on the podcast feed, or not. Maybe we won't. Maybe we'll just let it be what it is. But anyway, you didn't want to reschedule because
Yeah. I this has been coming for months. And I knew I was supposed to talk about this today. Like I think when I told you that I wanted to kind of change the topic, I knew for a while before I even had the surgery that I wanted to talk about this just because I was just so baffled about how much this situation with fibroids is not talked about, how many women were speaking up and saying that they went through this silently and um, just encouraging me that I was going to be okay. But the more I read, the more I learned, I was like, how do we suffer in silence? Nobody should go through this because it is a major thing. Whether or not these tumors are benign, so many women have lived in physical pain.
Mhm.
The fibroids that were removed from me were a little bit over 5 pounds.
Wow.
The stories that I've read, there's been a lot of women that had 10 or 20 pounds worth of fibroids removed from them. Somebody shared a personal story where their sibling lost about 40 pounds after the surgery from fibroid removal and just other stuff that they found because of the fibroids. So there's a lot of women who suffered way, 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 way more than I did. And so for me, that's a big deal. I really feel like, we have walks for breast cancer and domestic violence and so many other things. And I feel like we need to have walks for women's health around these issues because one of the things I didn't have pain, but I knew my cycles were so heavy. I knew that if I kept working in the office, I was going to have to ask for accommodations.
Right.
And then the question I had was, well, would I have been able to ask for accommodations? Is this even considered a disability?
Right.
Like how would that have worked? And thankfully, before it got to that point, we were moved to work from home prior to COVID, you know.
Oh,
Um,
wow.
yeah.
Great.
And so I was like, okay, but even working from home, it's still difficult to sit for 8 hours when you're that heavy and you still have to run back and forth to the bathroom and do things like that. But I felt really lucky. I did, and I forgot to mention another person in my family that went through this was another cousin who had surgery last year. And she's a truck driver. And so she had shared with me her experience going through that as a truck driver and how embarrassing it was trying to be a woman in a man's world of truck driving and you're trying to deliver a load and you got to keep stopping. You got to keep stopping. And ultimately, she chose to have a hysterectomy because she already had a child. But, that experience for her was just really traumatic and very embarrassing. And she's so happy to be free of it today.
Yeah.
And just even the history behind it. Now there's so many other options besides a hysterectomy. But for a long time, that's what doctors promoted to get rid of this issue.
Right.
And thankfully, with the work that has been done, there's a lot of other options for us now. I do still have the ability to have children, so that's a blessing.
Thank goodness.
But the scary part is it's the same incision as a C-section. And with everything that I just went through, now I'm like horrified about having a C-section because they tell you that because of the scarring on your uterus, you're more than likely going to have a C-section if you have children.
Mhm.
So now that's like a whole nother thing. Like,
well,
yeah,
I'm not a doctor, and
yeah.
I did have 3 C-sections because, it
Yeah.
was quite a long time ago. But there are a lot of women who have successful vaginal births after C-section or after other abdominal surgeries.
Yeah,
So,
that's true.
finding an OBGYN, this is a whole nother podcast that we could have here.
Yeah.
But
Yeah.
finding an OBGYN who is comfortable and well-versed and even an advocate for VBAC, vaginal birth after cesarean, will help you in that situation be able to make that decision.
And I'm grateful. I do have a really great OBGYN that I trusted to do my surgery and who definitely knew what I wanted, and promised to do everything in her power to do everything that I wanted. She knew how emotional I was about the possibility of not being able to have children and having that taken away. I feel like when she was in the room, I definitely was heard. There were some moments where she couldn't be in the room. And there's so many things that happen, Erin, that we would be here forever talking about it. Like, even in regards to this wound vac, there was a moment I'm remembering where not only was I not heard, but my family that was in the room watching was not heard.
Right.
But my doctor wasn't there. It was a assisting doctor. My doctor was in emergency surgery. So the assisting doctor did not install the wound vac correctly. She didn't listen to my dad and my sister. So I had some trauma with that. I had some painful trauma with that. And then also some painful trauma on removing it, because you have to change it every 3 to 5 days. But my main doctor was there upon removing what that first doctor did. And my doctor made sure that I was okay. She made sure that when she reinstalled it, it was done the right way, so I wouldn't have trauma. And what's amazing is I went to a wound care specialist for the first time this past Friday that my doctor referred me to. And, we were talking to her about my experiences with changing the wound vac. And she said, nobody should have to go through that type of trauma just to remove a wound vac. And so she was very concerned about the trauma that I had experienced with that first go around.
Amazing.
And she just literally, she did some things to remove the pressure off the wound vac. Just very, very different experience. So I will say that for those experiences that were not good, I had some experiences afterwards that made up for it.
Right.
I don't know why.
I think sorry, you don't know why what?
I don't know why that first doctor didn't listen. Except for that she thought she knew better, but
well, yes, and that's true. And I think that, there's never going to be a perfect medical experience, right? What we can all hope for is that for every negative experience, there are more positive experiences to balance it out, and that they're not obviously so severe. But again, at continuing to ask for what you need is so valuable. So what I will say to you is, based on what you said a minute ago about how there's, we could be here forever. I think there is something to be said for, giving yourself some time to heal, to complete this process, because you're still sort of in it. And then, remember and get some distance from this, and then come back and talk to us again about, how it is now, how it is then, what you've remembered, how things have sort of balanced out. Come back in a few months and we can talk about this some more.
Yeah. And I'm grateful for talking about it now, because sometimes when we wait too long to talk about it, we forget those really important experiences. And I know I have a tendency to do that. Like, I may have forgotten the experience of the doctor not listening, with that first wound vac. And, sometimes I have a tendency to be very optimistic, So talking about it this soon, I think, was really important, because it's almost real time. It's not real time, but it's still really fresh in my mind.
Yeah, totally. All right.
So, yeah.
Well, I so appreciate you taking the time to come and talk to me. Oh, look, it's Tara. She's joining us. Hello, love. what I will say to you is that your voice is so important in the work that we all do. And I am always, every time I see you or talk to you, which is not as often as I would like, you are positive, but you are also honest.
Mm.
Right? Like you are an optimistic person, and there's value in that. There's no question, but you're honest. You don't sugarcoat things, and you don't dismiss people's experiences. You don't dismiss your own experiences. You want to hold people and systems accountable.
Yeah.
And so that is an amazing quality. And I so value that. Thank you so much for being here. I
Thank you for
love
having me,
you.
Erin. I feel the same. I don't get to talk to you as much as I want to. I feel that that's a ditto for both of us. Yep.
Absolutely.
Yep.
So we'll have to make that change.
Yeah.
I do want to share though with our audience that actually almost 2 weeks ago now, we lost a member of our If You Could See Me family, and this is the first podcast that we're recording since his passing. Danny Holcomb was. It's going to be really hard for me to talk about this.
It's okay.
Was a member of our men's group that we did in 2019. He had recently completed training to become a peer recovery specialist. He was in the midst of earning his hours toward his certification. One of the ways that he was doing that was to become a facilitator of a men's and male identifying group here for If You Could See Me. And the day that he passed away suddenly from a heart attack, he had his first solo work group session with his group. And he was so excited about that process and about getting to go through that, about getting to share more stories himself, about getting to walk other men and individuals who identify as male into that along that journey. We had a Restory group that night. They all met me out for dinner because I was just under a week from when I was leaving to move to the West Coast. And, I hugged him and I told him that I loved him and that I would talk to him tomorrow. Right. And then I got a phone call the next morning, very early, that he had very suddenly passed. And Danny was beyond words. He was such a gentle spirit. He was so kind and so funny and sweet and good, and had been in recovery from a substance use disorder and bipolar disorder for many years, and walked that path with so much authenticity and so much truth and honesty. And he lived his recovery every day. He lived his recovery every day. He was active in the recovery community. He was active in AA. He was an advocate. He was a meditator. He belonged to, the Unity Church in Richmond. And he was a absolutely magnificent photographer and beautiful writer and storyteller. And I was so honored to know him and to grow from my experiences of being in his orbit. And I wanted to pay homage to him and honor him here today. He is so, so missed. And our community is the worst for him not being a part of it. So We love you, Danny.
We love you, Danny. Yeah. I didn't know him well, but I did get to see him speak.
Mm-hmm.
And he was one of those people that you would want to know.
Yeah.
Which I actually thought I was going to be able to really meet him because he was involved with Mental Health America Virginia, which is where I really got started with peer support and got my first experiences on facilitating peers. And so it's just really disappointing because he definitely was a light that shined very brightly.
Yep. He
So
was.
I just want to send hugs to everybody because I know this has really been a really, really hard experience. Yeah, I'm really, really, truly sorry about his passing. Truly sorry.
Thank you.
Yeah.
I want to thank everybody who has made donations to the If You Could See Me project in Danny's name. This project meant a lot to him, and folks have made donations to us, to Mental Health America of Virginia, as you said, to Unity, his spiritual home, and I will be creating some sort of a scholarship fund or some other type of fund in his name to be able to further his legacy and to continue the on some level the work that he was doing here in order to be able to to honor his memory and keep his work going. Yeah. So thank you all so much for spending your Saturday morning with us. We went very long, which is not surprising because
that's okay.
Jamie and I could talk all day.
Yep, that's okay.
All right. Yeah. I love you all. Have a wonderful weekend.
Yes.
Thank you for joining.
Love you too, Erin. Love everybody. And yeah, I'm just encouraged by this whole experience. I really appreciate you a lot. Yes.
Thank you. Well, it's nothing without you and all the folks who trust the process and who believe in the mission of, learning to use your voice and providing spaces for different people with different experiences to come together and share. So thank you, Jamie.
Thank you. All right. Bye-bye.